Welcome to another episode of Health Matters. I'm Heather Poland, and we are with the extraordinary PA, Lynn Szabo. What are we going to talk about today, Lynn?
Well, I'm on a tear about Cuba. So Cuba's medical system is like doing amazing stuff with no resources, which, you know, the no resource part kind of reminds me of Del Norte. And so I was inspired by an article in the online news, organization called Common Dreams. And it's an opinion piece, dates from June 4th, 2026, titled Cuba Works Health Miracles When Under U.S. Blockade by Naveed Kalra, who's apparently a contributing author. So I wanted to start with some basics of the Cuban system. First of all, they have free universal health care.
Wow.
Yeah, that's so far ahead.
Well, most everybody does, other than us, right?
Right. They have a high MD to patient ratio, and this is because they actually have one of the biggest medical schools in the world in Havana.
Wow, really?
Right. And I've done a talk about it before because I think more people who are interested in medicine and want to go in to be a physician should consider this as an educational choice. About 100 people a year from the United States go to this university. It's 6 years. They turn out 10,000 new physicians every year.
Holy bejeebies.
And their preferred student is somebody who comes from a poor community, who's female, who's indigenous, and is multilingual.
Wow.
Yeah, it's amazing.
So even with all the limited resources, they still have this amazing university.
Yeah.
Holy crap.
And it's part of why they're doing so well. So it's a 6-year program, and I think the last 2 years you're sent overseas, mostly to South America, but also other impoverished parts of the globe. And you pretty much work with the community. So they emphasize community ties. And the hope is that the educated physician will go back to their community that they were raised in and will be a healthcare provider in that particular community. Seems straightforward, huh?
It does. But Cuba does not seem like a very large country when I see it on the map. But I know that there's the distortion of the size of the land masses on the map.
Right.
But 10,000 seems like an awful lot.
That's a lot. So that means if it's a 6-year program that they have, it's like a small city.
Yeah.
That's 60,000 people. Well, they're not in Havana all at the same time.
I know. I mean, just like saying every year if they're putting out 10,000 new doctors in there.
They're putting them out in places like the slums of Colombia.
Okay, so those doctors are going globally.
Yeah, they're not just local
to
Cuba. They're internationally focused too.
I wonder if we can get some of our high school kids to graduate, go there, and come back and be our doctors so that we have some.
There actually is a nonprofit agency that I spoke about before in Oakland that helps an interested person get there. You don't really, I think, have to have a college degree. But it's helpful because all the classes are in Spanish.
Oh, yeah, that would.
But it's not unusual for physicians to train in a language that's not their original language.
Is that because it's all Latin-based?
No, that's because educational opportunities might not be in the country that speaks the language that your mom spoke to you. Oh, okay. So one of the first physicians I worked with actually was trained in Padua in Italy. And his anatomy was all in Italian.
Oh.
And so he'd be talking to me about, parts of the body using Italian words. And I'd be like, yeah, don't speak Italian. So there's a strong focus on preventative community-based medicine. Oh, God, that sounds so yummy, like you could eat it, like it's candy.
A little bit excited about that, are you, Lynn?
I am kind of drooling. They do more with less. They kind of have to, right?
Yeah.
Yeah. Specifically, and there's a lot of things they do better, but they have a higher life expectancy by 5 years when compared to the United States, and they have a lower infant mortality.
Jeez.
Which is
even with the
fundamental.
blockades we have put on them for
Mhm.
generations, they are
Mhm.
still doing better than we are.
Mhm.
But there comes, man.
Yeah, and so the U.S. has been blockading Cuba on and off for decades. I don't even really understand why, except they're communists. I don't know. What are we afraid of? They're obviously not focused on wars.
Anybody who's not white.
I guess so.
Seems to be the theme in the United States.
Yeah. So this blockading has resulted in a severe lack of basic supplies, diagnostic tools, and essential medicine.
Jeez.
So they're really getting great results with not even baseline fundamental amount of equipment. And then they're suffering also under things like power shortages, and their facilities are falling apart. I just don't get it.
Same.
They even have decreased sanitation, and there's problems with access to clean water. And then they're limiting they're to the point where they're limiting essential care and disrupting life-saving care. It's really sad.
It is.
Super unnecessary. But, this kind of trauma, I think, also provides innovation. And it's innovation that we can't even fathom here in the United States. So, number one, they've made healthcare a national priority.
Imagine that.
Whoa. Mind blown.
Right.
Yeah. And the government pays about $251 yearly per capita for medical care, which is one of the lowest amounts in the world.
Jeez.
But like I said, they have great MD training. And they go for people that are kind of the opposite of who gets into the medical schools in the United States. They're looking for young, not necessarily college degreed, but bright, committed to community, prefer indigenous females. Wow. And it really, really helps. It's not a limiting factor if you don't speak Spanish, but it really, really helps if there's the person's able to get by in Spanish.
Okay.
Yeah, it probably only take a month or two before they were more fluent. It's kind of like you get thrown in the ocean, you either sink or swim.
Yeah.
And in fact, the doctors that they turn out have an emphasis on early intervention and preventative health care. So in 2006, I thought this was interesting. The administration of George W. Bush offered asylum, tried to steal physicians from Cuba.
Jeez.
They offered asylum and permanent resident status to any Cuban doctors who wanted to come to the United States.
It's my understanding, because I've worked with people in different jobs that were like, I was a nurse or I was a doctor back in my country of origin, but I can't. My education doesn't transfer. Does a Cuban doctor's training transfer to the United States if they're not college degreed and they just have medical school graduation?
I think that's possible. And I think Bush tried to make it possible. That's what somebody said. If you graduate from this medical university in Havana, are you going to be licensed? Are you going to be able to, get into a residency program? Apparently it happens. About 100 people a year.
Okay.
Yeah. So
they put out 10,000 doctors to go to other countries, and then about 100 of them get into residency programs in the United States?
No, about 100 of them come from the United States a year. So average Del Norte indigenous person who speaks Spanish, who wants to be a physician but can't see herself paying for a undergraduate college education, but really, really knows she wants to be committed to medicine in this community, she can apply.
Okay, so if she goes to Cuba, she gets her education, and then she comes back.
Then she comes back, probably goes through, probably has to go through a residency.
Has to go through a residency here in the United States.
Mm-hmm.
Okay.
But they get paid for residency.
I know. It just seems like a weird process, and if we're not going to honor that degree and that education, then it kind of seems.
Well, a lot of doctors have to go through residency.
No, I understand. I mean, the education in Cuba.
Yeah. Yeah, but we're trying to steal them, apparently, or we have a history of trying to steal them. I know, actually, a lot of doctors who were trained out of the United States and came back here and persevered to get back into medicine. And it's remarkable what they can do with very little resources.
Yeah. But again, your choice of words was persevere to get to practice in the United States. It's not an easy process.
No, and it's probably different depending on where you got your training. You know, we had a hospitalist of some remarkable talent here in this community. It was from Afghanistan, and he was in a family, I think, where they had 10 kids and 9 were physicians as adults, and 1 was like a computer guy.
Wow.
And he trained in northern Pakistan. And so he didn't have CT scans and stuff, but he was brilliant. He was brilliant in his understanding of the science involved in medicine, like pharmacology, for example, and physiology. And he would always say, why are you ordering a CT scan? We already, we understand already. So,
because you have to. If you don't have that tool, you have to figure out another way to get that diagnosis.
Right.
And we didn't always have the CT scans to rely on, and we still took care of people.
Yeah.
That's amazing.
It is amazing. So Cuba's especially good in mental health care and elder care. Then I'm thinking, who's the indigenous female from Del Norte who can go for it? You don't have to pay for the care there. In fact, you get paid. You don't have to pay for going to school there.
Oh.
You get a stipend. It's not a lot. It's probably decreasing over time. But, I mean, doesn't that sound like we don't have anybody who specializes in elder care. No gerontologists, as far as I know, in this county.
We used to.
I mean, we have people who are kind of called to it.
Yeah, same with being a pediatrician. We don't have an actual pediatrician anymore.
You don't even get me started on mental health.
Yeah.
So what they do there, I think this is something that the different clinical factions in Del Norte are trying to do. So they integrate the hospital and the community care system in what they call polyclinics. And so polyclinics are community-based hubs that support the primary care system. And each is it's essentially like 20 to 40 little neighborhood doctor's offices. So think kind of like it would be in rural Mexico, where each small town has like a pharmacy and an associated doctor's office with it. And then they have an administrative umbrella. So about 20 to 40 of these smaller offices that are located where the people are have a more central administration. And then, but it still remains with the community focus.
Wow.
Which is not what we have here. We have a bunch of different systems who are all trying to do it their way.
Yeah.
And who are competing more than collaborative.
Yes. Because it's different if you go to Stellant versus Sutter versus Open Door.
Right.
Versus a private practice.
Every one of them has their vision of how they could create like a health village. This is UHS terminology. Like Padua, for example, a health village. You got the primary care people there. You've got the like physical therapy people there, the mental health, but like the Walmart of community clinics.
I was going to think of a mall, but yeah. Right, but if it's not collaborative because they're competing for dollars. It's profit driven. Even if they're nonprofits, they still want to collect the cash and sit on it.
That's right.
And pay their CEOs and do their parties and things.
And some people have a religious bent that other people don't share.
Yeah.
And some people have a loyalty to the hospital that other people don't share. And some people have a loyalty to Native populations. Go Team UHS, but not everybody. That's not everybody's primary thing.
Yeah.
An Open Door, I think, has a general idea that they want to do good in the world. And sometimes sometimes it's hard to define what that is.
Right. I can't wait to see him actually do that.
Yeah. Well, I do. Well, I can tell you when it happens. Saturday from 10 to about 1:30.
And then as an overall thing.
Oh,
Because we can do that on Tuesdays and Thursdays too, with Dr. Turner out there with a mobile bus.
Yeah, he's become quite a popular guy.
Yeah. And then you used to do that too. So I think that's more people than it is the business model itself of a nonprofit business model. I think it's the people there that are doing extraordinary.
I think if we got profit out of the way, then everybody could have their own wing and wouldn't be kind of their own house in the village, and they wouldn't necessarily be competing for resources. Because remember that they don't have profit in Cuba. They have really scarce resources, and they still work together.
Yeah.
And they not only work together within Cuba, but they work together internationally.
Jeez.
Yeah.
I'm getting mad.
I want to move to Cuba.
I'm jealous.
I could speak Spanish.
Everybody, well, you can. Everybody else has all of these access to these things, or even with the lack of access, it's not for profit. Somebody's life and death decisions, somebody's ability to function and to have quality of life and to maintain their dignity is not a for-profit model. And so even with the lack of resources, they have better infant mortality rates and better life expectancy than we do.
I know. It's really bizarre.
Sad. It makes me angry. I'm getting angry.
Yeah.
Sorry.
Well, anger fuels change sometimes. But there's a catch, okay? So their doctors are poorly paid, considering the quality of their training. And however, they're loyal to their practice. So they could make more money, for example, in Cuba, in Havana, driving a cab. Isn't that weird? They don't necessarily get enticed away to do that.
Wait, but it sort of makes sense. If you grow up in Cuba and doctors get paid, or just easy money here, okay? They get paid $10,000 a year. And cab drivers make $15,000 a year, and you choose to go to school for 6 years. Again, you're not going to have any debt for your college or for your education, because that's your love, that's your passion, that's what you want to do. Right. Then you've made that choice to make less money. And I understand that doctors here make well into the six figures, and so we expect that to have doctors get that everywhere. But if that is your system, then you've made your choice because that's your passion. The same way I continuously make less money working in nonprofits because that's where I find
that's where your heart is.
Yeah, so it's a choice, and so it makes sense that they're that devoted to their patients and to their communities.
Well, they're cultivated for that. That's part of how you get in, is you demonstrate a commitment to the health of your community.
But I also wonder too, right? If they're targeting women and they want women to do this thing and everything else, if it was men, would they pay more? If it was men that were doing these jobs, would they pay more?
That unknown. I don't know. I don't think we should assume that cab drivers are necessarily men.
No, I meant the medical field, because you've said repeatedly that they get women to do this and indigenous women to do this. If that was not the case, would that job pay more? Because misogyny exists worldwide.
Understood. But I also don't think I don't think it's a case of somebody else taking the money within Cuba. I think it's the United States taking the money from Cuba, or somehow setting up conditions so Cuba can't thrive monetarily. But this also kind of leads to a black market. So some people will pay under the table, and they will bribe for better care, like more expedient care.
Kind of like rich people do in the United States, where they have their specialty doctors and...
Right.
Okay.
Right. But, that's interesting. When George W. Bush tried to entice Cuban physicians away, he only got about 6,000 for the whole time he was trying. That's, considering they crank out 10,000 a year, that's not really very many.
Right.
So the article I read said the physician loyalty is to their community, which is cool. And then, their facilities are in terrible condition. They don't have the equipment they should. I don't know. You know, neither do we, but not to the extent I think that they have. And there are drug shortages, which must be heartbreaking to try and figure out who you're going to give meds to. And then you could say, is there freedom of choice there? I mean, what if I didn't want to go to the doctor that Cuba wanted me to go to and I wanted to go to another doctor? I don't know that I'd have the ability to. But you don't really have that ability here.
I was going to say, but I love how we say this about other countries and like, oh, if we had universal health care, you'd have to wait 4 weeks to go see the doctor. I have an appointment to see my primary physician and that's in 4 months. So,
right.
And it'll probably get canceled.
Right. But here's what they've done with these meager resources. They have recently released a second vaccine for lung cancer, which has increased survival by an average of 76 months.
Holy crap.
They released the first vaccine for lung cancer in 2011.
So you could get diagnosed with lung cancer and then buy a new car and pay it off because that's only a 60-month loan.
I think that's wild.
It is insane.
And there's really not very many Americans that have access to it, which is kind of interesting.
Why?
Because you have to go to Cuba to get it? I don't know. Maybe it's because it's for such a specific kind of lung cancer that not very many people actually have it or could benefit. They developed, during the COVID epidemic, they developed 5 vaccines.
Jeez. I'm stuck on the cancer one.
Mm-hmm.
Is it possible in any way, shape, or form that we can find out whether or not this is because lung cancer is such a profitable thing in the United States that if they gave us a vaccine and we got to live 75 months longer, that they wouldn't make as much money off of our suffering and death?
Here's what I think. Yes, I think money slows development down in the United States. So these drugs are developed in Cuba. Initially, they've got a really good, biotech industry there, and they give it out for free. So their goal is to better humankind.
Jeez.
And then they, they don't really limit access of it to other countries, and then the United States, gets a hold of it, and then it gets slowed down in bureaucratic mire.
Right. And like the same thing, like we don't allow imports here that are going to compete with U.S. companies because then we would know that the U.S. companies can't compete.
Right.
Like with Hiawatha phones and electric vehicles and all of those other things. They can be made better for less money and still brought to the United States.
And that's what happened with COVID. With these 5 vaccines, they made them available to the world at an affordable cost. And so death rates in Cuba due to COVID were really tiny.
Wow.
And they were the first to vaccinate their children, so they opened up their schools. And they did not try and make money off of it.
Imagine that.
Yeah.
What other countries use these vaccines?
Say that again?
What other countries use the vaccines that were originated in Cuba?
Mostly South America, but mostly countries that don't have a lot of money.
Okay.
They developed one of the first vaccines for Haemophilus influenza type B, which is a type of meningitis that kids get, and they shared it with other countries. So there's a theme here.
Altruism.
Yeah. They developed an early version of the hepatitis B vaccine, which was one of the first vaccines that was cancer preventative.
Wow. And that's huge because that's that can be passed to children through gestation.
Right. And this blew me away. So getting away from vaccines, they developed a drug that reduces amputations from diabetic foot ulcers by 75%.
Holy crap.
Which is used in Cuba, but is now hopefully going to be used in the United States, and somehow the bureaucracy has limited access to it.
Oh my God.
They have higher rates of controlled blood pressure. That blows me away. And they have something called Operation Miracle, where they offered free eye sight-saving treatment for people within Cuba, but also within and throughout South America, where they for free could travel to Cuba and get their eyes worked on to save them from blindness. I'm blown away. So I've been in medicine 40 years. I am obsessed about medicine. I read a lot of medical stuff. This was all unknown to me. I had like a vague idea that Cuba was doing it better, but they are really doing it better. So why are we blocking aid to them? Like, why? You know?
Because we've been doing it since the 60s.
I think you hit it right the first time. You said they weren't the right color.
Yeah.
I think it's time to start seeing what they're doing right and how we can copy this success. I mean, they're obviously into sharing it with the world. And, not only their knowledge, not only their ability to train outstanding doctors that focus on community medicine, their biomedical research, their amazing strides that they made with vaccines. It just seems to me that I don't see that matched with by American medicine. Medicine in the United States.
Right, but medicine in the United States, I'm not talking about the people who provide the medicine to us, like right. You and my friends that work in the medical community and family members who work in the medical community, not the individual people.
Right.
But our system. Our system is to maximize dollars for corporations, even the nonprofits that run these big, huge medical systems, maximize dollars and sit on billions, hundreds of billions of dollars, and then fundraise where we give more money and everything else so that we can pay for somebody to have eye surgery and save the sight or do this for a child or do all of those other things so that they don't have to access that money that they're sitting on to have parties and to say, look what I've done. And accumulate wealth. I am so
over it,
pissed off. I am so pissed off at the human suffering that we have for profit, because capitalism and capitalism isn't a real thing in the United States because it's capitalism for you and me, and it's corporate welfare for Walmart and J.P. Morgan Chase and Bank of America and everybody else.
And insurance companies,
the medical insurance companies, all of them.
United Healthcare.
Right?
You. Yeah, totally. But I think we have to start with making good universal healthcare a national priority. That seems to me to be foundational.
I agree, but we're just going to start bitching about that because in America, we are going to argue over whether or not you're a Republican or a Democrat and what color you need to be and what your gender is, or if you're gender fluid, and all of those things matter more than whether or not grandma's going to die or your grandchild's going to die.
Yeah.
Because we're dumb.
Yeah, we're really dumb.
We're just fucking asinine.
Right.
I might have to edit that out. Or not. All right, Lynn, I love you, and I appreciate everything that you have done for our community with little resources to keep us all alive, to keep our families together, and it's amazing, and I'm grateful.
Yeah, I got Cuba on my mind now.
Yeah.
So we'll see what happens.
I've got change on my mind now. Thanks, Lynn. I'll see you next week.
Alrighty. Bye-bye.